The vaccines are still waiting for emergency authorization from the FDA, expected any moment. When that happens, public health experts fear some Americans won't get vaccinated. Marcelo Benito looks at why this could be an even bigger problem in Texas.
We have a tough job ahead of us.
COVID-19 vaccines may be less than 2 weeks away now in Texas, but vaccine expert Dr. Peter Hotez and other health experts worry a bigger problem lies ahead. The vaccine won't do any good if too many people choose not to get it.
We need a really high acceptance rate.
Here's why officials are concerned. The latest Gallup poll shows only 58% of Americans are willing to get a COVID-19 vaccine. It's better than a few months ago, but still not good enough.
You have to get about 75% of the population vaccinated in order to stop transmission of the virus and interrupt herd immunity. And if you only have half the people taking it, you're not going to get there.
The problem bigger in Texas, a state already hard hit by COVID-19, where misinformation is spreading rampantly. Only 43% of Texas adults get a flu shot every year. That's already a big warning sign.
Texas is one of the epicenters of the anti-vaccine movement, and that's going to slow down acceptance of COVID-19 vaccines.
Just this week, anti-vax groups hung these signs off Texas highways, including here in Houston. Anti-vaxxers have energized and increased their efforts as more promising COVID vaccine news has started to come out.
This is terrible. We're not going to achieve success in public health unless we can figure something out about all of this.
Hotez says all health officials need to do a better job of communicating the importance of vaccines and shutting down misinformation in real time. There are side effects to the vaccine, mainly 24 to 36 hours of just feeling cruddy. But the data, Hotez says, shows they're safe, effective, and the best way to get us all back to normal.
95% efficacy, so they work. They're going to induce virus neutralizing antibodies that'll keep you and your family out of the hospital or out of the intensive care unit, and they'll save your life.
Marcelino Benito, KHOU 11 News.